Dear students, നമ്മൾ ഇന്ന് ഡിസ്കസ് ചെയ്യുന്നത് Dear students, today we will discuss about some community medicine paper 1 topics. One first question is that a third year MBBS student during his clinical posting observed that many patients had leukoplakia in the oral cavity. Leukoplakia in the oral cavity. State the objectives of the study. It is he wanted to find the risk factors for leukoplakia. So, what are the objectives of the study? One, to ascertain the risk factors for leukoplakia, identify and ascertain what are the risk factors. What is the study design used and why? Case control or cross-sectional with explanation. Best is case control study. It will be short duration. Other study designs, if logical explanation is correct, but do you go for case control or cross-sectional study? Then state the methods of the study. Suppose it is cross-sectional, enumerate the case of leukoplakia at a time and a question about the risk factors. Or the steps of the case control design. Example, define the case, define who is the control, define what is matching, what is analysis and interpretation. So, in a case control study, you should define the case, you should define the control, you should know how the case and the control is matching, you should analyze and interpret the study. State the methods of the analysis. So, the methods of study can be cross-sectional or case control. Methods of analysis means in the case of this study design, we can use odds ratio, that is by the formula ADE by BC, odds ratio ADE by BC. What sorts of errors can creep in? In every study, sampling error can occur, or even the in which cases or the case bias may happen. Next is a problem-based question, 5-mark question. As a medical officer of the PHC, Primary Health Center, how will you ensure adequate immunization coverage among the under 5s in the primary health community area? So, anyway, to ensure what is in your area, you should have the idea about that population. For that, we have to conduct a survey, get data on the basic immunization status, take the health education classes for the adolescents, the pregnant and lactating mothers, train the JPHNS, that is the junior public health nurses, and any health manpower available on the correct immunization techniques, implement the immunization on all scheduled days, and monitor and evaluate the coverage at the frequent intervals. So, suppose you are doing the study at the beginning of a year like a January month, have a review after 4 months, that is at around May, you should conduct another survey. For conducting the survey, what you can do is that if the medical officer is you can in the second survey enhance the number of people by training all the medical staffs associated with the primary health center to evaluate this condition. In this way, the analysis or the survey can be conducted very easily 2 to 3 times in a year. That should be the basic idea of conducting surveys. So, first time the medical officer itself has to do extra activities to train the all officials associated with the primary health center, then to go for conducting the surveys at the regular intervals, ideally 3 times a year. Then prepare a diet chart for a pregnant woman in second trimester having anemia. So, diet chart is another important one. Practical point of view, it is also very important. First, we have to know, you should know how to write the diet chart for a regular, moderate men and women. First, you should know, and you should study in such a way that how you should write the diet chart for a case in which like this, that is here the mother, the lady is a pregnant woman and she is in a second trimester and she has a health problem called anemia. So, the extra calories required during pregnancy is normal plus 350 kilocalorie per day. Extra protein is 78 gram per day. Extra cereals is plus 35 gram. Pulses is 15 gram. Milk should be 100 gram. Additional sugar should be extra 10 gram. In such a way we have to write. Then short 4 mark questions. We are going with first question, benefits of the ESI scheme. ESI scheme, as you all know, it is for the benefit of the employees. The state is assuring it. State means the government is assuring it, and it is a central government project. ESI, Employee State Insurance Act. So it has got some medical benefits, sickness benefit, maternity benefit, disablement benefit, dependence benefit, funeral expenses, rehabilitation. Biological control of vectors. How can you control the vectors? Use small fish to feed on mosquito larvae like Gambusia, Gambusia, Gambusia affinis, and Barbados millions for feeding the mosquito larvae. Fish can be used in burrow pits, sewage oxidation ponds, ornamental pots, and even cisterns. Biological control can be effective only when used in conjunction with other methods. Then only, what is our aim? We have to control the vectors. For that, we have to combine both biological control methods and the physical methods also. The next question is, what is active surveillance for malaria? Active search for fever cases in the community by multi-purpose workers. So malaria and all are a second paper portion. So for the active surveillance for malaria, what you can do is that search for fever cases in the community by multi-purpose workers and taking blood smear and treating for malaria based on the requirement. So anyway, malaria is a fever disease. So first you go to the community at the basic level, from the health worker level, you should collect the data who all people are having fever these days. From all the fever patients, collect the blood smear and look for it. Malaria can be easily identified. Malarial parasite can be easily identified by this staining methods. Okay. Then treat the malaria accordingly. Then 7th question, post-conceptional contraceptives. Post-conceptional contraceptive means it is not post-coital contraception. If post-coital contraception means post-conceptional means you have to what we are looking is that a husband and a wife, they had a sexual intercourse, they are now pregnant. The lady has already been conceived, but the husband and wife is eager to have sexual intercourse during the pregnant period also. They can have, there is no problem with it, but provided they take extra security care for the mother. Okay, so first we have to go for the menstrual regulation, then menstrual induction, then you can use oral abortifacients. So these are the post-conceptional contraceptives: menstrual regulation, menstrual induction, then oral abortifacients. So this case you should, I have mistakenly said post-conceptional contraceptive means there is conception has occurred, the lady is now pregnant, so they don't have, they are don't liking, they are don't planning for a baby, so they want to get rid of this pregnancy. What all things we can do, that is coming under post-conceptional contraceptive. First, what you do is by menstrual regulation, that is keeping the menstrual period, you can have drugs, have the menses to be normal from next time onwards. Then you can take drugs after consulting with a qualified gynecologist for having menstruation, that is menstrual induction drugs. Then you can take some medicines like mifepristone, which are oral drugs which act as abortifacients. That means the lady will have cramps and pains and she will be having extra bleeding and the pregnancy will be aborted. Then comes what is plumbism. Plumbism is a condition, medical condition related due to lead poison. The toxic effects of inorganic lead exposure is abdominal colic can happen, obstinate constipation, that is a constipation that is not associated with your diet. The constipation is very obstinate that the patient is very difficult to have fecus. Then loss of appetite, blue line on the gums, stippling of the red cells, anemia, wrist drop, foot drop are all the symptoms of plumbism. Make sure that why it is due to plumbism? It is due to lead poisoning, that you should not forget. Then it can have what are the effects? The toxic effects of inorganic lead exposure are abdominal colic can happen, obstinate constipation can occur, loss of appetite, blue line on the gums, stippling of the red cells, anemia can occur, wrist drop, foot drop, etc. can occur. Then what are the effects of the organic lead exposure? It affects the central nervous system, CNS of our brain. It can lead to insomnia, headache, mental confusion and delirium. So it is a CNS affecting drugs, CNS affecting chemical to lead. So lead poisoning or lead exposure can be inorganic lead exposure and organic lead exposure. Then next is a difference between question. Health education and health propaganda. Though the words seem similar, they are entirely different. What is health education? What is health propaganda? They are both different. Health education means to cause or facilitate the learning. Propaganda means to spread the particular systemized doctrine. We have to propagate it. That is, now the information is confined to only some people. We have to make sure this information is reaching to more number of people. That is the aim of the health propaganda. But health education means to cause or facilitate the learning. Then health education means having the knowledge and skills actively required, makes people think for themselves, disciplines primitive desires, develops reflective behavior, trains the people to use judgment before acting, appeals to reason, develops individuality, personality and self-expression, knowledge acquired through self-reliant activity. This process is behavior-centered, aims at developing favorable attitudes, habits and skills. So health education is basically a primordial way of prevention, whereby we create healthy habits, that is a favorable attitudes, aims at developing favorable attitudes, habits and skills. Then in health propaganda, the knowledge is instilled. The word you should use is the instilled. In health propaganda, knowledge is instilled in the minds of the people, prevents or discourages thinking, ready-made slogans, arouses and stimulates primitive desires, develops the reflexive behavior, aims at impulsive actions, appeals to emotion, develops a standard pattern of attitudes, behaviors according to the mold used. Knowledge is spoon-fed and passively received. This process is information-centered, no change of attitude or behavior designed, because the person will be having an attitude, but in health propaganda, like a motivation class speaking, the attitudes are already in that people. Only for 2 hours they are sitting together with us with our attitude. Sometimes many of them will be going out of this meeting. They will be sticking on to their attitude only. They won't be using our attitude that we discussed in that 2-hour motivation class. Likewise is the health propaganda. Knowledge is instilled in the minds of the people that aims, prevents or discourages the thinking by ready-made slogans we can use, arouses and stimulates the primitive desires, develops the reflexive behavior, aims at impulsive actions, appeals to emotion, develops a standard pattern of attitudes, behaviors according to mold used. Knowledge is spoon-fed and passively received. The process is information-centered, no change of attitude or behavior designed. We are not going to change the attitude, or no, we are not going to building a habit. We are just information centered, we will be passively feeding them. That is the basic agenda of health propaganda. So what is health education? What is health propaganda? Difference. Now comes the second difference between question. 10th question of this question paper. What is infection and infestation? Infection, I-N-F-E-C-T-I-O-N. Infection and infestation, I-N-F-E-S-T-A-T-I-O-N. Infection means the entry and development or multiplication of an infectious agent in the body of a man or animal. Entry, development, multiplication of an infectious agent like bacteria, virus, etc. in the body of a man or animal, the disease progresses. But in infestation, for persons or animals, the lodgement, development, reproduction of arthropod on the surface of the body or in clothing. Example, lice, itch mite, etc. Infestation means for animals or persons, the development and reproduction of arthropods on surface of the body in the or in the clothing, etc. Example, lice, itch mite is having infestation. Infection means the organism has entered into our body biologically, the body. But in infestation, it is only on the surface of the person or the animal. It can either be on the even the clothing of that person. Then difference question, epidemic and endemic disease. Epidemic, E-P-I-D-E-M-I-C. Epidemic and endemic, E-N-D-E-M-I-C. In epidemic, the unusual occurrence in a community or a region of disease, specific health related behavior, other health related events clearly in excess of expected occurrence. Very big numbers will happen. That will happen in the community or in a region. And in endemic means constant presence of a disease or infectious agent within a given geographic area. That disease will be in that geographical area constantly. It is not a unusual occurrence. In endemic, it is a constant presence of a disease or a infectious agent within a given geographic area. Now we are going to substantiate your answer with research. First question is, immunization against killer diseases of the childhood is cost effective. Killer diseases of the childhood. So killer diseases means there are certain diseases which we can't treat and cure. It is better prevention is for it. So it is also cost effective also if we are thinking in the economic way. Cost effective analysis. It's a quantitative method of management where the money input is measured in terms of lives saved. So immunization against killer disease like diphtheria, tetanus will in the long run reduce the money spent in treatment of this disease both by government and the patient, because you know once the tetanus or diphtheria has occurred and then we are treating means lot of money has to be pumped in for the treatment either by the government or by the individual patient itself. But think, if that same person has been vaccinated routinely by birth itself, this disease have been prevented. You see the difference. So immunization against killer disease of the childhood is a cost effective way of analysis or a cost effective method of treatment. The next question, specific protection is an important component of primary prevention. So there are many ways of prevention: primary prevention, secondary, tertiary and primordial prevention. Specific protection means it is an important component of the primary prevention. The intervention done in primary prevention is health education and specific protection. Even if you study that what is primary prevention means, primary prevention includes two components. First is the one called health education. The second one is called the specific protection. Health education and specific protection are the two components of primary prevention. Okay. Now, the specific protective methods. The specific protective methods like immunization, chemoprophylaxis that decrease the cost of treatment of the disease. It will decrease the cost of treatment of the disease. So, specific protective methods like immunization. Specific protective methods includes two. One is called immunization, the other one is called the chemoprophylaxis. Chemoprophylaxis. So, immunization is there, chemoprophylaxis is another. So, that will decrease the cost of treatment of the disease. Like specific protective methods like immunization we can do. This is a specific protective method. Chemoprophylaxis we can do. This is another protective method. Seat belts, protective gears, etc. decrease the accidents and the occupational hazards. Okay, seat belts. If you are driving, this is a specific protective method. Use the seat belt. While riding the motorbike, you should put the helmet. It is another seat belt specific protective method. Protective gears, that is where you are dealing with blood samples. It is very good that you use the gloves. Then it will decrease the accidents and the occupational hazards. Now going into list the following. Uses of mass screening. So mass screening, there are different ways of screening methods. First one is the mass screening methods. So in mass screening, it screens the whole population at a time. Not considered very useful because screening helps in case detection, control of disease, research and educational opportunities. Anyway, whatever be, mass screening is not very useful because we can't use very specific screening methods. Mass screening will be like a common test only. We can only use simple testing techniques for mass screening. We can't use highly sophisticated tests for mass screening. So, in mass screening, we are using simple test and it is not at all very useful. It is only useful for little purpose only. What we can find at the end is that we can take the case detected, then we can have the control of the disease, then we can do research and educational opportunities. What is the importance of the carrier state? So carriers are more dangerous than cases because they escape the recognition and live a normal life among the population or community. They readily infect the susceptible individuals over a wider area and longer period of time. So a carrier is always very dangerous than the case because they escape the recognition. Okay, they escape the recognition. They live a normal life in a population. They readily infect the susceptible individuals over a wider area and the longer period of time. Okay. What are the uses of epidemiology? Epidemiology, to study historically the rise and fall of a disease, we use epidemiological studies. It helps in community diagnosis. It helps in planning and evaluation of the disease. Evaluation of individuals at risk and chances. The syndrome of the identification we can do. Completing the natural history of disease. These are all possible only if we use a epidemiological study. Searching for the causes and the risk factors. What are the host factors in morbid conditions? Host factors in a morbid condition. A host is a person or other animal, including birds and arthropods, that affords the subsistence or the lodgement to an infectious agent under natural conditions. That it is a substance. Who is a host? A substance, a person, a animal who affords the lodgement of an infectious agent under natural conditions. The demographic characteristics are such as the age, sex, etc. of the host factor is always evaluated. Demographic characteristics such as the age, sex, etc. are always evaluated. The biological characteristics of such genetic factors are one, social and economic characteristics, lifestyle characteristics such as the personality traits, etc. So, the host factors in a morbid conditions. So, who is a host? A host is a person or a substance who affords the lodgement of an infectious agent under the natural conditions. Here we use the demographic characteristics such as the age, sex, etc. The biological characters such as the genetic factors will come into play. Social and economic characteristics will come into play. Lifestyle characteristics such as the personality traits will be also be affected by the host factors in the morbid condition. Next question is the stages of the demographic cycle. The different stages are, one is the high stationary phase, early expanding phase, late expanding phase, low stationary phase, the declining phase. So first comes the, in every demographic phase there will be a high stationary phase. For many of the years the demography or the demographic numbers remain constant, that is called the high stationary phase. Then comes a early expanding phase, then a late expanding phase, then comes a low stationary phase, that is coming to play with a declining phase. Okay, so these are the different stages of a demographic cycle. Okay, so we will discuss the next questions in the next video module. Thank you. Have a nice day. God bless you.